Okay guys, this is chapter 11 or the endocrine system. So you can read some of the slides, the first few slides at home. And I start with here. So there is two different terms. One is endocrine system and the other one is the exocrine system. So these are both secretory systems, and they are made of epithelial tissue, but there is a big difference. The endocrine system, they don't have ducts, and they directly secrete into the blood, which means it can go anywhere in the body, and if a tissue has a receptor for it, then it can affect that type of tissue. If there is no receptor for a tissue in the tissue, then that hormone has no effect. But the exocrine system is different. Exocrine system has a duct, and it drains in a duct, and that duct may go into different cavities like lumens in the body, or it can go outside of the body. For example, the sweat gland, it can drain in the surface of the skin, or it can be saliva, which it can be in the mouth, or secretions in the respiratory system or the intestine and stomach. So that's the exocrine, but we will talk about the endocrine system. So endocrine system, they secrete hormones, and the hormones may have short-term or long-term effect. They are very important for homeostasis. They are important for the metabolic rate, so it will change the metabolism. It will increase or decrease, depends on the body need. It will affect the metabolism of glucose, lipids, and proteins. Also, it's important the amount of water that's in the body, so that also related to the blood pressure and blood volume. It is important for a balance of different minerals like sodium, potassium, calcium, phosphate. So some of those are important for nerve function, for muscle function. Some of them are important for bones, and some others are important for other body functions, cellular function. There is also important for immune system. So there is there is a hormone that is released by the thymus, and that affects the immune system. There is also important for short-term and long-term, related to reproductive system and growth and development. So sexual function can be a short-term, or the effect of the sexual function, which is for conception and formation of embryo and fetus, and then birth of the baby and the growth of the baby, and that will take years. So that can be short term and can also be long term. So endocrine has a lot of different functions. If you compare the endocrine system with the nervous system, the effect is very, very short, but endocrine system can be short, or it can be very long. So this is the different hormones that are released from different glands. So I start here. This area is called hypothalamus. I will discuss this in more detail when we get to the nervous system. That for now, know that the hypothalamus has a lot of effect on different glands, and the most important one is the pituitary gland. And the pituitary gland is a master gland that will affect many other glands. So these are the hormones that are released from the pituitary gland. The pituitary gland has two parts. One is the anterior lobe, which are these hormones, and the posterior lobe, that are these hormones. MSH is released from middle part of it. It is not important for adults. So let's go the effect of these different hormones that are released from the pituitary gland. One of them is called the adrenocorticotropic hormone, and that hormone is affecting the adrenal gland. I will come back to the functions of these glands later, okay? The TSH or thyroid stimulating hormone, this is the one that is released from the pituitary gland and affecting the thyroid gland. So if you see a tropic word or if you see stimulating word, those two means they are released from the pituitary gland. Growth hormone, that is the one that have a major effect on majority of the tissues in the bodies, including the musculoskeletal system, the liver and other organs. So that's important for growth, especially when you're young. But once your growth stops, then the late puberty, the growth hormone is important for balance of glucose. So it keeps the glucose level high in the blood. Prolactin is important in women during pregnancy, and that is stimulating production of milk in the mammary gland or in the breasts. Follicle stimulating hormone and luteinizing hormone, these are the two hormones that are stimulating the gonads, testes in male and ovaries in female, and I will come back to the functions of those later. MSH is important for production of melanin, and that is for a pigment in the skin. So that these two hormones are released from the posterior pituitary gland. They are made in hypothalamus, but they are stored in pituitary gland, and if there is any stimulus for it, they are released. One is called antidiuretic hormone, and that affects the kidney, and it will cause a reabsorption of water. So in case you have hypovolemia or dehydration, this is the hormone that is released. And the other hormone is called oxytocin. The most important function of oxytocin is during labor, when the uterus is stretched, oxytocin is released, and that will cause contraction of uterus, and the baby is delivered. Also important for let down of milk from the mammary gland. So when the newborn starts suckling the breast, then oxytocin causing contraction of smooth muscles, and that will cause the milk that was produced by the influence of the prolactin, then that milk will come down, and that provides nutrients for the baby. Another gland is called the epithalamus. So epithalamus is in this area, and that is the one that produces melatonin. So melatonin is important for sleeping. So when the light amount decreases at night, this is where melatonin is secreted, and that's how it makes you sleepy. So if you are using a computer or TV or your cell phones or any other electronic devices for a long period of time, then the amount of light that goes to your eyes inhibits release of melatonin, and you cannot go to sleep properly. So I recommend you to stop using electronics later in the evening. So after 8 o'clock, probably is not a good idea to do that. You can use books and notes to study for the material if you want to sleep. This slide, you do not have this in your slides, but the information is in your textbook, but you can also write it here from this slide, and that's a summary of the other hormones that are released from the body. So we start with the thyroid gland. This is the thyroid gland. It's located in the neck. It's posterior to trachea. It has an isthmus and two lobes, and it produces two different hormones. One is called thyroxine or thyroid hormone, and this is important for the metabolism. So it increases metabolic rate and increase cardiac activity, increase oxygen uptake, and increase red blood cell production and production of ATP. Calcitonin, when the level of calcium is high, this hormone is released, and that will reduce calcium level in the blood, and that calcium is precipitated back on the bones. Parathyroid, there are 4 of them, and they're located in the posterior part of the thyroid gland. So this image is not very accurate because they should be in the posterior part of the thyroid gland, not anterior. And they are important for calcium. They're really important because calcium has a vital function in the body. So when the level of calcium goes down, the parathyroid hormone is released, and that will break down calcium from the bones, and that will cause release of calcium, and that increase calcium level, which is important for cardiac function, for skeletal and smooth muscle function, and the neurological function. Thymus is located here in the back of the sternum, the breastbone, and that is producing a hormone that's called thymosin, and that is the one that is affecting the lymphocytes, that is stimulating production of the lymphocytes, the T lymphocytes, which is for part of the immune system. Adrenal gland, these are the two adrenal glands or suprarenal glands. They are located on top of the kidneys, superior in the kidneys, in the back of the abdomen. It has two parts. One is the cortex, which is the superficial part. The other one is medulla, which is the inner part. The cortex, it produces three different hormones. One is called aldosterone. So if the level of sodium and water in the body decrease, aldosterone is secreted to increase level of sodium and water, and in turn it will increase the blood volume and blood pressure. Cortisol is important for keeping the glucose high in the blood, so that can break down other reserves, energy reserves in the body, so keeping the glucose high enough for normal body function. And androgen, a small part of androgen is produced from adrenal cortex, and not that important in men, but important in female, because that is increasing libido or sexual desire, and also pubic and axillary hair growth in female. Adrenal medulla, they are getting direct contact from hypothalamus, and they are producing epinephrine and norepinephrine, and that is released directly to blood, and it will have a lot of different functions. So increasing activity, increasing concentration, and heart rate is increased, blood pressure is increased, cardiac activity getting high, and there is a breakdown of the glycogen and fat from different areas in the body. Gonads, so in male, these are the testes, and they are producing testosterone. Testosterone have two different functions. What is important for spermatogenesis, which is production of sperm, and the other one is for secondary sexual characteristics like deepening of the voice, growth of the muscles and bones. They are important for growth of hair, and also for development of the genitalia. In female, there are two hormones secreted from the ovaries, and one is estrogen, the other one is progesterone. Estrogen is important for the normal menstrual cycle, and also for secondary sexual characteristics in female, like redistribution of fat in the breast and in the pelvic area, and also the growth of hair, pubic and axillary hair. And progesterone is important for pregnancy. So to maintain the pregnancy, you need to have progesterone. Initially, it is produced by the ovaries, but then once the placenta develops and grows, and then placenta provides the progesterone. Some signs and symptoms. One is called endocrinopathy. So pathy is a very general term, means just abnormality or a disease. It does not give you any specific reason why the person has the disease. It just might give you some ideas. For example, there is an abnormality in the glucose, or growth and development, or reproduction. Then you can say this person may have endocrinopathy. Syndrome is multiple signs and symptoms together that gives a specific disorder. Sometimes it's hard to explain every single symptom and sign, and that's why it's called syndrome. So if it does not always make sense that why the person has this many different symptoms from different parts of the body, then that can be called a syndrome. Gynecomastia means that the size of the male breast increase. So this is actually a boy that the size of the breasts are enlarged. It is more a cosmetic thing. It can be due to increase in estrogen level, but when men getting older, they also may increase and may have gynecomastia. So it's not any any abnormality except cosmetic. Hirsutism is increase the facial growth in female. This is actually a male, but I should have chosen a different color, a different image. But just if you can look at it, so I have too much hair in the face, and that is again cosmetic, but it can also be a very important medical problems. For example, the person may have a tumor of the adrenal gland, or they may have the tumor of ovaries, and they may get hirsutism, or they may be getting a lot of steroids outside, external steroids, and they may develop hirsutism. Sometimes some women may have hair in their face, and that can be just genetic or familial, so it may not have any specific disease. Edema is accumulation of fluid in the body, and especially in the lower extremity because of the gravity. That's the most common area. You can also have it in the back and in the sacral area, so it depends on how the person is lying down or the person is sitting. There's two types of edema. One is called pitting edema, P-I-T-T-I-N-G. And if you press your finger against the bone, then you can get an impression of your finger, and that is because of kidney problems, heart problems, or liver problems. So it's too much fluid or in the body, or loss of protein is lost, or not enough protein is produced in the body. The other type of edema is called non-pitting edema, and if you press against the bone, nothing happens, and that is usually from lymphatic accumulation of lymphatic fluid, and that is a lymphatic obstruction. So there's a big difference between the two, and the treatment is also different. Exophthalmos means the eyes are protruding. You can see the eyes, and the reason for this is that the person usually have a thyroid disease, and the tissue that is behind the eyeball that swells up, and that will cause protrusion of the eye. So these eyes become infected, and they become dry. So it's a sign of thyroid disease. Obesity, that a person have too much fat in their body, and that may be because of decrease in physical activity or eating too much, or they may have some underlying genetic problems. So it is one of the most common cause of morbidity and mortality, both morbidity and mortality. So it can be prevented, and also it can be intervened. So if it's morbid obesity, it can decrease survival rate. Polyuria means the person is producing too much urine. In this case, the person is not producing enough ADH, antidiuretic hormone, and that's why the person has polyuria, or the person may have diabetes insipidus, and too much glucose in urine, and the glucose is carrying water with it, and that's why they have polyuria. So more than 3 liters per 24 hours. Diseases of the adrenal gland, one is called Addison's disease, and this is where the aldosterone level is decreased. Aldosterone is important for absorption of sodium and water. So if there is not enough aldosterone, the person is losing sodium and water, so that's why the person is weak. They have a hypotension and a weight loss. And John F. Kennedy had Addison's disease. Cushing syndrome is that the part of the adrenal cortex that is responsible for production of cortisol, there is a tumor there, or the person may have a tumor of the pituitary gland, and there is too much cortisol in the body. So they will have a moon face, it means the face is round because of the obesity. They may have a buffalo hump, too much fat accumulated in the back. They may have abdominal obesity. They have these striae, which are these stretch marks in the abdomen. And they have breakdown of the proteins in the limbs, so the limbs are thin. They may have hypertension and weakness, and because of the weakness is because of the breakdown of proteins. They may have excessive hair growth and osteoporosis, breakdown of bones, and the loss of calcium there. So they may have also psychological problems. So there are a lot of different things, but this is a benign tumor, not malignant. A pheochromocytoma is a tumor of the adrenal medulla, and here is too much epinephrine. Norepinephrine is released. That will cause sudden increase in the blood pressure, and this is why the person has also heart palpitation, because heart is more sensitive to norepinephrine and epinephrine, and that is activating the sympathetic system of autonomic nervous system. They will also have headache because of the increase in intracranial pressure. They may get dyspnea because there's too much mucus is produced in the airways, and they have anxiety and stress. That's because of a higher level of epinephrine, norepinephrine, and anytime there is too much of it, the person is not able to focus on a specific task, and that's why it gives the person anxiety. There is another condition, it's called adrenal feminization, and in this case the actual patient is a male, but showing secondary sexual characteristics of a female. So like it's a male patient, and as you can see gynecomastia there. That can be a genetic reason, or it can be too much female hormones produced. Maybe they may have a tumor or something. Adrenal virilization is just the opposite, that is a female but is producing too much of the male hormones. So this is a female and it has a lot of testosterone, so that can be an ovarian disease, a tumor of the ovaries. It can be a tumor of the adrenal gland, or they may be taking it from outside. So sometimes it can also be genetic conditions. Parathyroid diseases, one is called hyperparathyroidism, which means there's too much parathyroid hormone is released, and the parathyroid hormone function is to activating osteoclasts. Osteoclasts are cells that breaks down the bone, and that will cause release of too much calcium in the blood. So that calcium can precipitate in different parts of the body, for example, in cornea, in pancreas, in the stomach, in the brain, different areas. And hypoparathyroidism is not enough parathyroid is produced, so that will cause hypocalcemia, which is really bad. Hypocalcemia may cause arrhythmia, cardiac arrhythmia, which can kill a person. Also, it will cause tetany, and tetany is the painful muscle contractions. When the level of calcium decreases, the amount of sodium in the nerves increase, and that increase in sodium, it will cause depolarization, and that will cause contractions. So tetany can be a symptom of hypoparathyroidism. Disease of the pituitary gland, one is called gigantism. This is when there is a tumor of the pituitary gland, but that tumor is benign, and that's happened during childhood or during puberty. So there is an area in the bone that is made of cartilage, and that is called epiphyseal growth plate, or growth plate, just a general name, and that is the one that makes the bone longer. So if that is still open and the person has a tumor of the pituitary gland, then the person becomes like a giant, very big. But once those epiphyseal growth plates are closed and the person get a tumor of the pituitary gland, then they will get acromegaly. Acro means extremities or the ends. So here the person will have an increase in their jaws. They will have they also have the increase in size of their head, so their hat will not fit properly. Their hands become increase in size, so their fingers the rings will not fit in their fingers, and also their feet increase in size, so their shoes will not fit anymore. Both of them are benign conditions. They may cause headache, and it will cause muscle weakness, and it will cause also vision problem because it will compress the optic nerve. Opposite of that is another condition. It's called hypopituitarism. It means that the pituitary gland is not producing enough hormones, and any of the hormones can be affected, but the ones that are really important are the thyroid hormone and hormones from the adrenal gland. These are really important ones. So if it happens during childhood, that will cause dwarfism, which is the short. The person will be very short, and also if it happens in other times, and it will cause diabetes insipidus. It means that antidiuretic hormone is not secreted, and that the person is not able to reabsorb water, so the person is urinating a lot. So that's why the person has polyuria, and because of this polyuria, the person becomes really dehydrated, and that's why they are drinking a lot, which is polydipsia. And in this image, you can see the shortest man in the world, and this is the tallest man in the world. So this will have a pituitary dwarfism, hypopituitarism, and this person has a gigantism, which is the pituitary gland tumor, just the opposite of each other. Hypothyroidism. So this is that the thyroid gland is not working properly, and this is also called myxedema. So during childhood, the person height will be very short, and it will also have problem with the development of the nervous system. So they will have mental retardation, and also they will have a physical shortness in their height. They also get anemia. They will have cold intolerance. They cannot concentrate. They feel weak, and they feel really cold. One of the causes of hypothyroidism is called congenital hypothyroidism. The person is born with it, so that's why, as I said before, they will be short and they will be mentally retarded. So anybody that is born in the Western countries, that they get a TSH, thyroid stimulating hormone test, and that will tell you if the person has hypothyroidism or not. And if they have it, then you can treat it easily. Hashimoto thyroiditis is a type of inflammation of the thyroid gland that will cause destruction of the thyroid cells, and that's an autoimmune condition. This happens usually in women, and that will cause hypothyroidism. So they will have symptoms of hypothyroidism. So Hashimoto thyroiditis is just actually a cause of hypothyroidism. Hyperthyroidism is just the opposite of that. It may also be called thyrotoxicosis. Here there's too much thyroid hormone, so the heart rate increased, the person have a lot of appetite, but they will lose their weight because their metabolism is so high. They will have diarrhea compared with hypothyroidism, that they have constipation. So these hyperthyroidism patients have diarrhea. They cannot concentrate properly. They talk a lot, they sweat a lot, and they have intolerance to heat. One type of hyperthyroidism is called Graves' disease, and this is this person will have exophthalmosis, which is the protruding of the eye, and thyromegaly, which is increase in the size of their thyroid gland. These patients may also have tremor, which is rapid involuntary movement of the hands. Goiter is decrease in iodine. So if the person is living away from the ocean and not eating enough iodine, either through salt intake, because table salt usually have iodine, and also if they don't eat fish, then they have higher risk of goiter. And you can see this patient, this is the thyroid gland that's increased in size. Why they increase in size? Because they want to hypertrophy the cells, increase in size and also number, and so they can pick up as many iodine as possible in the blood, because the thyroid gland is the main location or a storage area for the iodine. Some tests that you can do, one is the blood serum test, and for that you can look at the level of sodium, you can level of calcium, glucose, lipids, different hormones. If the glucose are what you're worrying about it, for example, you think the person may have diabetes, then you can do fasting blood test and sugar test, and this is done at night, and then you ask the patient not eat anything overnight, and when they come in the morning, you take the blood and you can check the level of glucose. Another one is called glucose tolerance test, and you give some meal that contains glucose, and then you wait 2 hours and 3 hours, and based on the amount of glucose, then you can say if the person has diabetes or not. So different ways to test it. And also they can check the urine, and they look at the level of sugar in urine. Normally you should not have any sugar in your urine because kidney reabsorbs it, but if it's too much glucose filtered from the kidney cannot absorb all of it, so some of the sugar will be in urine, so that will indicate diabetes mellitus. Some other diagnostic tests, one is called radioimmunoassay, and this is to check the specific level of different hormones. For the thyroid, you have different tests. One is called thyroid function test, which is T3, T4. These are the two thyroid hormones, and TSH that is released from the pituitary gland. TSH is normally as a screening test, so if you think the person has hypo or hyperthyroidism, this is the test that you do. And if there is an abnormality here, then you can check T3 and T4. Thyroid echography is the ultrasound of the thyroid gland. So this is the trachea, and this is the thyroid gland. This is the isthmus, and these are the two lobes. One lobe here, one lobe there. So you can see any mass, any cyst, any kind of abnormalities. You can see it with echo. You can also do a biopsy if you see any abnormalities. And the thyroid scan is that you inject a nuclear medicine, and that contains radioactive iodine. As I said before, the cells in the thyroid, they like iodine a lot. They want to store iodine. So normally you will have a big reserve of iodine in the thyroid gland. So if the person is normal, so you can see the thyroid gland really dark. But if the thyroid gland is damaged, then you can see it faint. Or sometimes maybe there's a cyst there. You can see one small area that does not pick up anything, and the rest is normal. So that way you can see it. Some treatment, one is corticosteroid, and that is to reduce inflammation. If the person has decreased glucose level, that's another option, but it's usually for inflammation, so second line of treatment. Insulin and oral hypoglycemics, these are given for diabetic patients. If the person has type 1 diabetes, they usually start with insulin. The person with type 2, which is much more common, they usually start with lifestyle changes, for example, changes in the food intake, and they shouldn't eat too much sugary food and too much fatty food, and they should exercise more. And if that doesn't help, then they can start with oral hypoglycemics. If that doesn't help, then with insulin. So different levels of treatment. If the person has diabetes insipidus because of the damage in the pituitary gland, then you can give vasopressin, which is ADH, antidiuretic hormone, so that will cause absorption of water from the kidneys. If somebody has hypogonadism, it means that there is ovarian failure or testicular failure, or if they are removed surgically for any reason, then they can replace the hormone, and that's the one they can give it. If somebody has hyperthyroidism, there are 3 different options there. One of the options is called chemical thyroidectomy, that they can give medication, and that will cause damage to the thyroid gland, and that will reduce the function of the thyroid gland. So it will reduce hyperthyroidism. And that's it. And if you have any question, you can ask me later.